So,
Now, when it comes to health literature, um,
I'm in class
you
right
know,
now, studying.
there was a study by
gigs on a cruise ship. But I worked with a lot of staff from other countries, and all the doctors were from places like Romania. There's also a lot from other poor countries, but the ones from Romania really struck me because if anybody doesn't know this,
intentional injury is one of them, but suicide, heart disease, and liver disease. And so some of this might have a behavioral component, but suicide, heart disease. But then we have to look at that. Well, can we create a better opportunity to improve the health experiences and outcomes of these individuals? Infant mortality, twice as high compared to Caucasian infants in other places in the United States. So we also look from a public health standpoint, we can look and sort of dig into specific demographics. Right now, among the LGBTQIA plus communities, we see that there's extraordinarily high self-harm and suicide rates. These are things that could be addressed, right? These are things that have become politicized, and that politicization of it is leading to the deaths of pediatric patients. And that's not how the newspapers think about it, but it's leading to the deaths of kids, right? These are things to think about, and also then not wanting to access the healthcare system because they're fearful that their provider will judge them also, right? Is my provider homophobic? Maybe I just won't go to the doctor. How do I find a doctor who's an ally, or et cetera, et cetera? And that can be challenging, navigating that system. CT.
I just had a quick story to share. So my youngest is transgender, and they were non-binary at first, and that was when they were about 12 years old. And their mom and I were totally fine with it. The family was fine. The school district was great with it. But we did say no physical intervention. We're fine with you, saying you're they, them, but, we're not doing physical things. And they were starting to feel very depressed, and we were taking them to counseling. And the counselor was saying, you cannot counsel body dysphoria away. And he recommended that I go to this event called Gender Odyssey in Seattle. And I went there and I talked to endocrinologists, surgeons, psychologists, and they all told me the real way to treat gender dysphoria is through doing medical intervention. So hormones, surgery. And so it totally opened my eyes to this. And then, of course, we're like, okay, we got to do this. We got Julian on T, and then they had top surgery. And at OHSU in Oregon, we have the Oregon Health, really good hospital there. And they have a whole department for transgender. And the insurance covers the top surgery. And so what my point is after that, Julian's spirits completely lifted, and their depression went away, and it was pretty remarkable.
Well, thank you so much for sharing that very personal story and your family story, and very prescient to this idea that you took the opportunity to learn more, and then you sort of understood the medical implications of different approaches or not approaching certain things certain ways, and it had direct beneficial outcomes, right, to the individual. So that's really cool. And so thank you for sharing that. It's so important, and this is where, as professionals, wherever you are on your perceptions, biases, beliefs, tenets of your faith, wherever you are, we're still professionals, and we still have to meet patients where they're at without judgment or shame, and counsel them accordingly. And that's our duty. That's just our basic duty as healthcare providers, right? And so if there's a hang up there, that's work you as providers have to do. If you feel uncomfortable because of a patient's sexuality or gender identification or skin color or spiritual path, that's a reflection of you and something inside you that needs to be addressed, not the patient. And that's very challenging sometimes for healthcare providers to hear, right? And yet we all like to think we're good people, but once again, we could also have areas that we haven't really understood or explored within our own biases about things too. And it's important to get that sort of squared away, right? I had this is neither here nor there, but there's certainly a need. When I was teaching at another institution, I've taught practice management for over a decade at various institutions, and pre-COVID, in person, I had a student at a school here in the Midwest, and part of her business plan was, and this was probably around 2015-ish or so, was she wanted to really have a community clinic that was very much putting out there here in Minneapolis that it was a trans-friendly TCM clinic, because there were none that were actively advertising. There were plenty of providers who absolutely would work with trans patients, but there were none who had any specialized training. There were none who actually kind of went and did the extra research. There were none who were of the community, and there were none who were publicly advertising, this is the community this clinic is for. And out of all the students, like many of you, if you started your own practices, like from the ground up, from day one, on your own as a business owner, many of you probably didn't, most of you probably did not experience that on day one, your books were full. Like the day when you start practice, you were scheduled out. This particular one was, she started her advertising before her license got in place. She started some blog posts. She started actively marketing, hey, this is coming to the Twin Cities. This is the community we're reaching out for because you've been underserved in this arena. And she was profitable in the first year, covered all of her expenses, all of her overhead costs, no debt. And as a new practitioner, that's unusual in our field. At least it was, 10 plus years ago. And it was because she found not just a market or a niche, but she was also of that community. She was well-versed, educated in the specific health needs of that community. And she wasn't afraid, despite that there were folks who would go online and just slam her practice, she was not afraid to actively market and advertise publicly for that community. And we're 10 years in and she's still booked, months and months out. It's hard to get an appointment in that clinic. So there's a lot of work to be done in all different arenas, a lot of work to be done in a lot of different areas here, both in the healthcare system as a whole, but also in what we can provide too. Just some more statistics about the LGBT and trans plus community. Mental health, huge component here, huge component. 40% of adults report being rejected by their family. So if we already talked about from a public health standpoint that familial connection is a social determinant of health outcomes, 40% are now already behind the 8 ball just due to lack of family connection, right? Due to their sexuality. 86% report harassment at school in what are supposed to be safer spaces for folks. PTSD, 120% higher rates of houselessness among the LGBTQ youth. So more and more folks living, without knowing where their shelter will be for the night. And that, of course, is going to impact health outcomes in those communities. All right, folks, why don't we pause here, and then we'll take our first break, and then we'll come back, finish this up, and move on to today's discussion. So if you have any questions or comments you'd like to share, pop them in chat. We'll get to them on our return. Otherwise, we'll take a 10-minute break. It looks like it is 12:30 Pacific time, 12:31. So let's come back at 12:41 Pacific time. All right, cheers, folks. See you soon.
Recording stopped.
All right, it's break time, y'all.
Knock me up and up in bed and I won't be waking. You're the best I ever had. I'm guilty of this. Blue lights, red lights, we gon' get real out tonight. Blue lights, red lights, with you. Anything that feels this good, but it must be illegal. Illegal, illegal. Anything that feels this good, but it must be illegal. Must be illegal. So call us criminals, criminals. Criminals, criminals, criminals. All your time, I don't know that's what you want. Where the way you blow my mind, just be against the love. Blue lights, red lights, we gon' get fell out tonight. Blue lights, red lights, with you. Anything that feels this good, but it must be illegal. Must be illegal, legal. Anything that feels this good, but it must be illegal. Must be illegal. So call us criminals, criminals. Call us criminals, criminals. With you. Must be illegal, legal. Something is wrong, but it must be illegal. Call us criminals.
Are you ready for the sequel? Ready for the latest? Got enough people. It's gonna be the greatest in a golden cathedral. All the greatest for the Texas, and if you boo-hoo, hey, look my man. Hey, look my man.
Thank you for joining. See y'all later.